Hi everyone, myself Pavithra. I'm working as a nursing tutor in E.S College of Nursing. Today we have to discuss about the chronic obstructive pulmonary disease COPD. It's a respiratory tract disease. It's a group of disease. Okay, in this COPD, shall we move on to the introduction? Okay, chronic obstructive pulmonary disease is also known as chronic obstructive lung disease. Then in this chronic obstructive airway disease, mainly in the COPD, it's obstruct the functions of the lungs. Main in this COPD affected the bronchi, that is a bronchitis, infection and inflammation of the bronchi, then emphysema. It's a alveolar membranes breakdown. Mainly in two things are affected for this COPD condition. It's a group of disease, mainly bronchitis and emphysema. Okay, it is a group of respiratory disorder in which airflow is obstructed. Then emphysema or chronic bronchitis and asthma are the common disorders that affect the movement of air in and out of the lungs. Main in this inhale and exhaling process is affected and obstructed by this condition. Then chronic bronchitis and emphysema are quite common and often occur together. Then what are the etiological causes? First one is a cigarette smoking, then chronic respiratory infection like sinusitis and long-term exposure to irritant that damage the lungs and airways. Then alpha-1 antitrypsin deficiency and the genetic disorder. If asthma left untreated, lung damage over time can lead to COPD. In case previous history of asthma condition is there, means they will should not take proper treatment, means they occur in the COPD condition. That's the chronic stages of the respiratory disease. That's all the etiological process. And one more is the pollution and chemical exposure. These are all the causes for this COPD condition. Then risk factors, it's a air pollution and cigarette smoking and hereditary disease, the genetic predisposition. Then age is the most people affected the more than 40 years of age group. Then clinical manifestation mainly will occur in the respiratory common signs and symptoms. First one, cough, that's a productive cough, and dyspnea, that's a difficulty in breathing. Then wheezing, crackle sound are heard. Then diminished breath sound. Then tachypnea, it's a increased respiratory rate and uses of accessory muscles of respiration. Then fatigue, weight loss. Then chest tightness, then thoracic deformities like barrel chest and pitting edema, then decreased the partial presence of the oxygen level and the elevated of the partial presence of the oxygen level. Then blue bloater and pink puffer. This is the main symptoms of this COPD condition. That's a chronic bronchitis, that is a blue bloater. Then emphysema, it's a pink buffer symptoms. Okay, in this blue bloater, that is a chronic bronchitis symptoms, it's a chronic productive cough and purulent sputum, then hemoptysis and the blood. Then blood in the sputum, then mild dyspnea initially. Mild dyspnea, it's a starting stage. Then cyanosis due to the hypoxemia. Then peripheral edema, then crackles and wheezing, then prolonged expiration, then obesity. These are all the blue bloater symptoms, while untreated means they go to the complication. In this complication is the secondary polycythemia, where due to hypoxemia, decreased oxygen level in the blood. Then pulmonary hypertension due to the reactive vasoconstriction from hypoxemia. Then pulmonal from chronic pulmonary hypertension. These are all the things comes under the blue bloater. It's a chronic bronchitis symptoms. Then pink puffer, it's a emphysema. The main symptoms is a dyspnea, then minimal cough, then increased need of ventilation, then pink skin, then pursued lip breathing, accessory muscle use, then cachexia, then hyperinflammation, then barrel chest and decreased breath sound and tachypnea. These are all the symptoms will occur in the emphysema, it's a critical stage. Then in this complication may go to the pneumothorax due to the belay, then weight loss due to the work of breathing. These are all the chief complaints for the COPD condition in the complication stage. Then shall we move on to the diagnostic evaluation, mainly medical history and physical examination. Either in this history collection we have to collect the either past, present medical history, and physical examination we have to identify the and monitor the vital signs. Then in the inspection we have to analyze the either barrel chest or the chest raise movement. These are all any abnormalities to find out. We have to helpful in the physical examination. Then atrial blood gas, it helps to determine the oxygen need by indicating the degree of hypoxemia and helps to avoid the carbon dioxide necrosis. Next one is the blood test, that is a CBC, complete blood count. Then chest x-ray and CT scan, helpful to support underlying diagnosis. Then pulmonary function test, it helpful to assess the lung function and to support the diagnosis of underlying condition. Then electrocardiography, it may show the arrhythmias consistent with hypoxemia. Then atrial blood gas test and lung function test and the walking test and the X-ray, CT scan, AIT deficiency test also we have to take on for this condition, COPD condition. Then mainly management to the based on the stages we have to provide the managements. First stage, it's provide the increased movement by the walking, biking, etc. Then eat a nutrition rich diet and avoid trigger like mold, dust and perfume. These are all the things we have to following in the stage 1. And stage 2, the joining a smoking session program and attend peer support group and focus on managing symptoms. Then third stage, it start the pulmonary rehabilitation program and practice breathing exercise and stay as active as possible despite the severe symptoms. Then fourth stage, the quiet smoking and including cigarettes and continue the management strategy as designated in the stage 3. See the healthcare provided the regularly. These are all the things we have to follow the regularly. Then medical management like the bronchodilator or corticosteroid and the expectorants and the antibiotics and breathing exercise. These are all the medical management. The bronchodilator such as the deriflin to alleviate the bronchospasm and also they enhance the mucociliary clearance of the secretion. Then corticosteroids mainly helpful for the inhaled or oral steroids to reduce airway and inflammation and relieve the shortness of breath. And expectorants, those drug helpful in the removal of secretion. Then antibiotic to allow the treatment of respiratory tract infection. Then breathing exercise. Mainly in this breathing exercise, the pursued lip breathing. The breathing is slowly through the nostrils to the count 1, 2, 1, 2, 2. Then the pursue your lips and breathe out slowly through your pursued lips to the count 1, 2, 3, 4. So inhaling and exhaling process be done by the breathing exercise. The nursing management, it's auscultate patient breath sound and respiratory rate, rhythm and any signs of hypoxia. Then monitor the vital signs and palpate for ferometers and provide high Fowler's position to patient, which helps to facilitate full lung expansion and enhance air exchange because of the patient having the breathing difficulty. That's why we have to provide the Fowler's position where patient is helpful to breathe easily. Then instruct rising mouth with water and spitting, not swallowing, and uses of mouthpiece during inhalation of corticosteroid. Mainly we have to advise the patient to this exercise. Then advise the patient to inhale properly during the medical management. Then teach the rationales for breathing exercise, coughing effectively. Teach the rationale for breathing exercise and coughing effectively. Then administered medication as ordered by physician. Then administer oxygen therapy as physician order. Then instruct the patient to increase fluid intake within the cardiac tolerance. Then instruct the patient to take well balanced diet. Then encourage the patient to avoid smoking. Then discuss respiratory medication and side effect and adverse reaction to the patient. Then teach importance of medical follow-up and periodic chest x-ray and sputum culture. Then provide emotional and psychological support to the patient. And what all the complication may occur for the COPD condition. First one is the pulmonal and respiratory infection, which can lead to acute respiratory failure also. Then spontaneous pneumothorax, then hypoxemia, then pulmonary hypertension. These are all the complication may occur while untreated COPD means are improper treatment. Then nursing intervention, improving the airway clearance and maintaining adequate gas exchange and relieving the anxiety and reducing risk for infection and improving the activity tolerance, maintaining the adequate nutrition and promote sleep, enhancing knowledge about the disease and medication. This is all the intervention. Then patient education and health maintenance, educate the patient about the COPD, what to expect and how to treat and live with it. Then advise the patient to avoid exposure in indoor and outdoor pulmonary irritant and particulates including the dust, smoke and other respiratory irritants. Then instruct the patient and family members to keep entire house well ventilated. Then encourage the patient to shower with warm to avoid excess exposure to steam. Then stay away from fumes, smoke and dust. Then drink a lot of non-caffeinated and non-alcoholic fluids. Mainly we have to advise the patient this. Then patient education and health maintenance, stay away from people who have who have cold or flu. Then instruct patient about proper sequence of medication using the bronchodilator and first followed by the inhaled corticosteroid, and can encourage patient to eat healthy food such as the fruits, vegetables and meats, fish and the low fatty dietary product, and instruct the patient and family members to contact the healthcare provider if they notice the following. Mainly we have to notice this many symptoms. Follow-up care, mainly the patient comes in this many symptoms is occur means fever or chills, more mucus and bloody or smelly mucus and swollen ankles. That's all. Thank you.